Hey, everyone. Today, I want to help you understand a critical aspect of animal welfare and scientific integrity, the use of analgesics and anesthesia in rodents. This session is designed for FELASA B level, perfect for PhD students and postdocs beginning their work with these species. Let's begin by clarifying two important terms that are often confused. Analgesia refers to the relief or absence of pain. The animal may still be awake, but doesn't feel pain. Anesthesia means the animal loses sensation, often becoming unconscious and immobile. Both are crucial but serve different purposes, and knowing the difference is key to applying them correctly. Why is managing pain and anesthesia so important? First, it's an ethical obligation. We must minimize suffering as part of the 3 R's framework, especially refinement. Second, pain and stress cause physiological changes that can distort your experimental data. Lastly, there are strict legal requirements, such as the European Directive 2010/63/EU, making appropriate analgesia and anesthesia mandatory in research. When it comes to analgesics in mice and rats, we primarily use 3 classes. NSAIDs, like meloxicam and carprofen, which reduce inflammation and pain. Opioids such as buprenorphine, which are potent pain relievers but need careful dosing. And local anesthetics like lidocaine and bupivacaine, which block nerve signals at the surgical site and are ideal for minor procedures or as adjuncts. Now, looking at dosages for mice. Meloxicam is typically given at 1 to 5 milligrams per kilogram once daily, either subcutaneously or orally. Buprenorphine is dosed at 0.05 to 0.1 milligrams per kilogram every 6 to 12 hours. Lidocaine is used locally at around 2 to 4 milligrams per kilogram but must be carefully dosed to avoid toxicity. For rats, doses are generally lower. Meloxicam is given at 1 to 2 milligrams per kilogram subcutaneously once a day. Buprenorphine doses range from 0.01 to 0.05 milligrams per kilogram. Bupivacaine is used locally, usually at around 2 milligrams per kilogram, with effects lasting up to 4 hours. The reason analgesic doses are generally lower in rats than in mice comes down to several physiological and pharmacokinetic differences between the species. The first reason is the metabolic rate differences. Mice have a higher metabolic rate relative to their size compared to rats. This means they tend to metabolize and clear drugs faster, often requiring higher doses per kilogram to achieve effective blood levels. Next is the body surface area and volume distribution. Differences in body composition and surface area influence how drugs distribute and are absorbed. Rats, being larger, may achieve effective drug concentrations at lower doses per kilogram. Then there is sensitivity to drugs. Rats may be more sensitive to certain analgesics, so lower doses achieve the same analgesic effect while minimizing side effects. And let's not forget the toxicity thresholds. Rats sometimes have lower tolerance for specific drug side effects, so recommended doses are kept lower to avoid toxicity. The main benefits of analgesics include significant reduction of pain and distress, which leads to better animal welfare. They also promote faster recovery and reduce physiological stress, which can improve the reliability and reproducibility of your data. Importantly, analgesics can be administered before, during, and after procedures. However, analgesics aren't without downsides. There can be large individual variability in response. NSAIDs might interfere with inflammatory or immune parameters in your study. Opioids require repeated dosing, which increases handling stress. Additionally, oral administration can be unreliable, especially in group-housed mice, where dosing accuracy is difficult to ensure. Moving on to anesthesia, there are injectable agents like ketamine combined with xylazine or medetomidine, and inhalant agents such as isoflurane and sevoflurane. Local anesthetics also play a role, especially as adjuncts to systemic anesthesia. Each has different properties, advantages, and limitations that influence their use. Inhalant anesthetics like isoflurane and sevoflurane are popular because they allow rapid induction and precise control of anesthetic depth. Typical induction doses for mice and rats are 3 to 5%, maintained at 1 to 2% during surgery. Proper scavenging systems must be used to protect laboratory personnel from exposure. For injectable anesthesia in mice, ketamine at 80 to 100 mg per kilogram combined with xylazine at 5 to 10 mg per kilogram, administered intraperitoneally is common. Medetomidine combined with midazolam offers muscle relaxation and is reversible with atipamezole, which can be a benefit in some protocols. In rats, ketamine is dosed at around 75 mg per kilogram combined with 10 mg per kilogram of xylazine. Alternatively, ketamine with medetomidine is used for longer procedures. Monitoring anesthetic depth throughout the procedure is critical, using reflex checks and observation of respiration. The key advantages of anesthesia include reliable immobilization and muscle relaxation, which are essential for many procedures. Inhalant anesthetics allow fast recovery and easy adjustment of anesthetic depth. Injectable anesthetics don't require specialized equipment, which makes them practical for many labs. But there are also drawbacks. Anesthetic agents can depress respiratory and cardiovascular functions, which increases risk during long or complex procedures. Inhalant anesthetics require costly equipment and trained personnel. Injectable agents lack the flexibility of inhalants, as you cannot titrate once injected. To summarize the difference, analgesia relieves pain but doesn't cause unconsciousness. Anesthesia causes unconsciousness and loss of sensation, but doesn't always provide adequate pain relief on its own. For many procedures, combining both is essential to maximize animal welfare and scientific validity. For a major surgery like a mouse laparotomy, a typical protocol might be preoperative meloxicam given subcutaneously, followed by induction and maintenance with isoflurane inhalation. Postoperatively, buprenorphine is administered subcutaneously every 8 hours for up to 48 hours. Careful monitoring throughout is crucial to ensure welfare and recovery. For minor procedures such as a rat foot pad injection, local anesthesia with lidocaine may be sufficient, avoiding the need for general anesthesia unless the procedure is more invasive. After the procedure, the animal should be observed closely for signs of pain or distress and treated accordingly. Postoperative monitoring is just as important as the drugs themselves. Tracking body weight, using grimace scales to assess pain, observing activity levels, and inspecting the wound site can help identify animals in distress early and improve outcomes. To wrap up, analgesia and anesthesia serve different but complementary roles. Knowing when and how to use each properly is critical. Effective pain management improves animal welfare, enhances scientific data quality, and keeps your work compliant with legal and ethical standards. For further reading and guidance, I recommend reviewing FELASA guidelines, the NC3RS resources on refinement, ARRIVE guidelines for reporting animal research, and always consulting your institutional SOPs and veterinary staff. Thank you all for your attention. I'd be happy to answer any questions you have or discuss specific scenarios related to your research projects. Like, share, and subscribe for more.